Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Brexpiprazole. Is this the answer? Anybody who's worked with patients with Alzheimer's or has been in inpatient wards knows that they become rock'em sock'em robots, especially at night. And agitation can be very difficult to treat. And you listen to the experts and they say, oh, don't use atypical antipsychotics. There's black box warnings. Understood. Don't restrain the patients. That's understood. But what happens when you have an 80-year-old female that's just playing rock'em sock'em robots with your staff and just running down the hall screaming, agitated? What do? And you listen to these experts and you can go to their lectures, listen to their podcasts, read their books, and they really don't have answers. Maybe this is the answer. This is the answer that we can start to establish a better treatment for these people that are going through horrible disease of Alzheimer's with behavioral disturbances. This study showed improved agitation in patients with Alzheimer's disease dementia. They basically did placebo versus Brexpiprazole 2 milligrams versus 3 milligrams daily. It really didn't see much difference between the two dosings. Now, it is pretty costly at this time, so hopefully that reduces. These patients were selected. They had Alzheimer's disease with dementia, with aggressive behavior. And it's an atypical psychotic. There was 345 participants total. The mean age was 74 years old. And they did 2-to-1 ratio, meaning that placebo of 1 and then 2, the two different groups of dosings. Guess what? The Brexpiprazole had a significant reduction in agitation inventory scores compared to placebo. Maybe this is the wonder that we're looking for in those who have to take care of patients who are sick at night or even sick during the day. But the sundowning is a real thing during the day. Now, 7% had adverse reaction, and it was mainly headaches. Headaches was the big thing. So let's see if this is a chance for us providers to take back the night and help our staff take back the night too in patients with severe Alzheimer's disease dementia with behavioral disturbances that can hurt themselves, hurt others, and hurt staff.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.